Merhaba, I am Betul Tosun. I am very happy to be here with my friend. Our study is case report, nursing care of a patient with osteogenesis imperfecta according to Kolcaba's comfort model. My presentation plan, as you see. Nursing care plan according to nursing models based on nursing theories offers a professional, systematic, and comprehensive approach. The main goal of nursing as a professional discipline is to provide patient care, and one of the pillars of nursing practice and research is assessing the comfort status of a patient and providing comfort interventions. Comfort is a theory based on the concept of comforting. It was developed by Kolcaba and has the potential to affect the perspectives and practices of other healthcare providers in healthcare settings. Comfort is immediate state of having the needs for relief, ease, and transcendence, addressed in four contexts of holistic human experience: physical, psycho-spiritual, environmental, and socio-cultural. And osteogenesis imperfecta, known as fragile bone disease, is the most common genetic bone disease that deteriorates comfort of patients from the early years of life. According to the National Association of Orthopedic Nurses, orthopedic nurses view their patients as whole people with physical, psychological, cultural, social, emotional, and spiritual needs. Also, they should aim for the highest standards of nursing practice to provide optimum patient care. The patient's perceptions of care, which is influenced by their comfort during hospitalization, has been an important consideration in healthcare delivery. This perception is related to the nurse's ability to meet the patient's immediate physical and clinical needs in a timely manner and to provide a comforting physical presence. Our aim is, this case report was the test feasibility of Kolcaba's comfort model in nursing care of a patient with osteogenesis imperfecta. This study was designed as a case report. Nursing care of a patient with osteogenesis imperfecta was planned and implemented in accordance with Kolcaba's comfort model, and the outcomes were evaluated. Case type 3 osteogenesis imperfecta, 13 years old female, triangular face, short stature, blue sclera, and scoliosis. Diagnosed on first month after birth, began to walk on 18th month. Mobility was restricted as she got older and experienced fractures frequently. She was hospitalized due to fractures, average 4 times a year. She was hospitalized for femur fracture for the second time, and she first had a femur fracture when she was 11 years old. She knew the disease, had developed self-protective behaviors, and was comfortable in interaction. She was educating at home, not going out so much, and spending most of time at home. She was feeding with mashed food as she lost most of her teeth at early age. She was living with her mother and sister and was not provided psychiatric support. Her father was working in another city for a military personnel. And as you see, taxonomic structure of comfort needs of patients. Uh, Relief, the state of having a specific comfort need met. Relief is the state of having a discomfort mitigated or elevated. This is the state that an individual feels when needs are met and distress is over. Gaining back the prior functioning and resting in peace, consequences of specific comfort needs met. For example, a patient who receives pain medication in postoperative care is receiving relief comfort. Is the state of calm and contentment, means transcendence, the state in which one can rise above problems or pain when they cannot be eradicated or avoided. You can see our plan about this patient. Relief, patient, pain and immobilization, anxiety, fear of getting injured, environmental safety at home and in the hospital, social isolation, absence of father. Is a comfortable bed and support surfaces we need, a proper position reducing pain, uncertainty due to lack of knowledge on undergone surgery and feature, and family members and healthcare providers' lack of knowledge using a wheelchair, spending time with peers, interaction with father, transcendence, gaining the state of I can cope with this pain, and feeling calm and relaxed with the help of healthcare professions, and developing the I will get better thought, feeling a safe environment, thought of I can use wheelchair, thought of I am not alone, with the social support of family and friends. Comfort nursing interventions are interventions, pain management, exercise plan, mobilization and position change, professional psychological support, environmental safety and at home and in the hospital, encouraging the use of the wheelchair because she did not want to use it. She was feeling bad about wheelchair, social support interventions and training. As a result, coping with pain, mobilization, anxiety, safe environment, social isolation, comfort needs of patients were met with the help of family members and healthcare providers, and promotion in physical, psychospiritual, environmental and socio-cultural comfort was observed. Nursing care of patients with Osteogenesis imperfecta, planned in accordance with Kolcaba's comfort model, may minimize the unpleasant experiences of patients and their families. Findings of this study may guide nurses caring patients with Osteogenesis imperfecta. Thank you very much.
Questions? Is type 3 the worst?
Type 4 the worst.